CyberPeace Institute. Thank you for joining us for the conversation today around the CIT Health Platform, the Cyber Incident Tracer for Healthcare platform, and on the discussion around the threats and trends in the attacks to the healthcare sector, and how we can work together with the use of data and information to reverse this negative trend. We have an absolutely terrific panel today with us. It's a truly multi-stakeholder and multidisciplinary panel today. So I'm very, very pleased to see that. I will briefly introduce our panelists, and then I will turn to Stéphane Deguin, the CEO of the CyberPeace Institute, to present the platform and talk about the work of the CyberPeace Institute in the area of healthcare. And after that, we will turn to panelists for substantive conversation around these issues. So let me just start with those introductions. So the first speaker will be Stéphane Deguin, the CEO of the CyberPeace Institute. Next, we have Mr. Richard Kadlčák, who is the Special Envoy for Cyberspace and also the Director of Cybersecurity Department at the Ministry of Foreign Affairs in the Czech Republic. Mr. Kadlčák is the top cyber diplomat in the Czech Republic who's dealt with the coordination of international cooperation in cybersecurity area for many years and represented the Czech Republic in many important conversations related to the sector. The next speaker is Dr. Koldura Droge, the Chief Legal Officer and the head of the legal division at the International Committee of the Red Cross. Dr. Droge is the Chief Legal Officer, and in her capacity, she leads the ICRC's efforts to uphold, implement, and develop international humanitarian law, including in the protection of the healthcare sector. The next speaker is Mr. Flavio Aggio, the Chief Information Security Officer at the World Health Organization. He spearheads all the efforts with the IT globally to safeguard the confidentiality, integrity, and availability of WHO's digital assets, and he works on government's risk management principles and procedures, and also security standards. The next speaker is Ms. Kaja Siglich, who is the Senior Director for Digital Diplomacy at Microsoft. Kaja spent, as a part of diplomacy team, many years working on issues related to international peace and stability to advance trust in the computing ecosystem, and also have provided lots of important input to different diplomatic and international initiatives in this area. And last but not least, it's Jeff French, who is the lead analyst of the COVID task force at the US Department of Homeland Security, Cybersecurity and Infrastructure Security Agency, also known as CISA. So with this really stellar lineup, I'm hoping that you all will ask a lot of questions today. But before your questions, I will let Stéphane to present and introduce the work of the CyberPeace Institute in the healthcare area and also the current project we are here to discuss. Thank you.
Thank you very much, Lara. Thank you for the introduction. It's a pleasure to be, engaging in this discussion, which is more, in fact, a journey that the CyberPeace Institute has still newly created entity. End of 2019, joined last year. But I know that for all of you in the call, it's a journey that you started long ago, and as the journey to provide security, safety to patients, healthcare professionals in the context of their need or work. So it's the journey to protect healthcare, and a journey to make sure that healthcare is beyond any capability of criminals or other groups to attack. So just a step back here, we, CyberPeace Institute, started cooperating with several stakeholders in this field last year. Mostly we engage with colleagues here in the call in different initiatives. But what was the idea? The idea was to provide a capacity, knowledge, practical support to also help decision maker to know how to navigate the problematic with the ambition to stop attacks on healthcare. Where are we? 1 year ago, we coordinated a call to government in close cooperation with the ICRC to remind all governments in the world about the fact that healthcare is to be protected obviously not to be attacked, but more importantly, protected. So after this call to government, several activities took place on our end with the help and cooperation with the partners here in the call in order to elevate this problematic to the right level so that states and other entities would look into this as a priority to protect healthcare. So this call to government was followed by the production of an analytical report that you can find on the website of the CyberPeace Institute, where we looked into the landscape, the threat landscape of what healthcare professionals and patients are facing. Because at the end of the day, what's interesting for us is what is happening to them. It can be ransomware, it can be cyber espionage, it can be big campaign of disinformation, but at the end of the day, these are the victims, and through these victims, there's a deep and costly societal impact that all of us are going to pay for the long run. So we issued this report in March with several recommendation to government, recommendation to industry, to civil society, to healthcare professional, because to solve this is a multi-stakeholder adventures, let's say. And the example here to have public sector, private sector, international organization around the table to discuss about what we could achieve in 1 year most is a good example. So very recently, yesterday, this recommendation took shape, at least one of these took shape in the format of the Cyber Incident Tracer that you can access via the CyberPeace Institute website. It's a platform that took a good 1 year of thinking, development, and what's the aim? The aim is to provide a data-driven understanding of the impact of these attacks on healthcare. Because you all know this, it's been years, more than a decade, in fact, that we are talking about wake-up calls. We need to wake up after WannaCry. We need to wake up after... And in the end, we still see attacks on healthcare. In the platform that you can access throughout the website, we could analyze data over more than 230 attacks happening in more than 33 countries. And if you focus on one type of attack, only ransomware, for example, there's already almost 4 attacks per week since the beginning of the year. So the problem is still there. So what can we do? What kind of solution can we find in order to address it? And that's how I would like to launch the discussion for the group. And some key points I would put on the table for the conversation. We identified building this platform, doing this analysis, discussing with practitioners or with victims, that there's a significant gap in the availability of information. And I would like to put this point in the open, because as long as there's no information about what is happening, it's almost impossible for anyone to do a sound policy making, but also for victim to have a possibility for redress and justice if they don't even know what is happening to them and what are the accountability level. So this is a point. The second is with that, how the colleagues feel about the understanding of the scale and the impact of attack. And then having this in mind, would welcome a recommendation, ideas, sharing of other initiatives that are out there. That's the aim of this conversation. So thank you all for participating. And it's very good to have this conversation today. Thank you.
Thank you, Stefan, for that introduction. I think Stefan laid out what we've seen through the Cyber Incident Tracer in 1 year's time. This is obviously a topic that's in the headline almost, unfortunately, every day. There is different initiatives at diplomatic, operational, industry level. So I'd like to now talk to those who can tell us a bit more, go beyond the headlines as to what is happening in the sector and what is the role of their community in protecting this healthcare sector. So, Cordula, if I may turn to you first, could you share with us the work of the International Committee of the Red Cross, some of the things you have seen and some of the initiative you are undertaking to increase the resiliency and protection of the sector? Thank you.
Thank you very much, Carla, and thank you, first of all, to the ICRC, to you for letting the ICRC speak on this panel. It's a real pleasure and an honor. Secondly, and I think most importantly today, we congratulate the CyberPeace Institute for the development of the Cyber Incident Tracer. And more broadly, also for the important work you
Sorry,
have.
can I interrupt you for a second? The sound is not great. I don't know if it's just me, but there's an issue with the sound.
Is it better now? Can you hear me better now?
A bit, but it's like a filtering noise on top of it. It's so strange.
I don't know. Sarah, can you hear me well? Or?
Yeah, I will. Would you have a set of headphones, Cordula? That sometimes helps. If not, we can move to another panelist, and then I'll see again if we can help with the sound.
Okay, thank you.
Sorry about that. So staying with the theme of the attacks on the sector and what we have seen in the past year, and some of the trends, and really the importance in understanding, what is happening to this sector in the decision and policy making. Flavio, could you share with us what you've seen in your work, what your constituencies are facing, and how you're using the information to change to change or try to affect change in this area? Thank you.
No, absolutely. Thank you. Thank you for the opportunity. What we saw in the last year or so due to the COVID-19 cyber attacks was a lot of impersonation, email impersonation, website impersonations that impacted the entire sector, because most of the cyber attacks that happen, 90% and plus or more, are really originated or part of mail, emails, spam or scam, spear phishing, those types of attacks, and everyone individually or companies, hospitals, industries are being impacted, and even WHO. So WHO, we saw a huge variety of attacks coming via email or via impersonated websites. And once we got in connection and with the help from governments and private institutions, we increased our defense systems. And this is what I'm trying to participate in multiple experiences and sharing like this one to incentivize organizations to activate technologies that are available today. And those technologies like DMARC, the name is really geeky, but the essential is to enable a protocol so your email will not be impersonated. And by doing that, we did that in 30 days in WHO, and by doing that, we eliminated about 50 million emails that were impersonating WHO. And so attacks against WHO and attacks against governments and manufacturers impersonating WHO personnel. And the email was coming exactly at WHO.int. And by only activating that protocol, we minimize a lot. We didn't eliminate 100% because we need the industry, we need governments, we need everyone to activate that. And this is well undermined. And because it is a technical policy, it doesn't attract a lot of people. So hopefully, with my contribution here, I can really help the organizations to incentivize just that activation, because again, 90+% of the attacks will be diminished because email impersonation is one important element. And another component that is quite important is the time to detect an attack, because we can try to talk a lot about prevention. And let me give you bad news first. It's almost impossible to prevent. It's almost impossible because every software will have a vulnerability, or zero-day vulnerability, or a vulnerability that you didn't have the time to close. So having multiple layers of security, the first one is the detection, and you have multiple layers of vulnerabilities multiple layers of protection to prevent those attacks, and also improves the time to respond. So the fact that you can invest more money and personnel and processes improvement on detection and the ability to respond will improve a lot the security posture for any organization. So this is what I have to share based on the experience that we had a year and a half ago.
Thank you, Flavio, for that. I mean, you outline what you're seeing at the technical level when it comes to the sector, and that despite the trends, that we're seeing, it's still hard to convince the decision makers to make the change. Cordula, I will turn to you now. Apologies for the technical challenges. We'd like to hear Flavio outline what's happening at the deep technical level, but we know that the medical sector is continuously attacked, and healthcare sector, both in cyberspace and in physical life. So over to you to share with us what you've seen and some of the efforts you're undertaking. I think you're on mute, so are you okay?
No, we can't hear you.
Yes, with apologies, we'll check if we can do something on our end. This is just the pitfalls of technology and trying to meet and talk about these important issues. And maybe if you try the settings of the headphones, or let's try without the headphones one more time, if that's going to help us.
Now we still see you muted.
Yeah.
Yes, you're on mute now, but we don't hear anything. Sorry for this, Claudia, very sorry.
Should we, I'll turn to Kaya now, and then let's try third time the charm. Let's try it without the headphones, and we'll try to turn up the sound. Sorry, Cordula, for this. So Kaya, we've talked about a lot of the key themes. Was the attacks continue? There is an availability of data. There is issues at the technical level, but from the perspective where you're engaging, both with your with the technical experts at Microsoft, the perspective of the industry, but also you've engaged so many times with different governments and international processes. What trends you are seeing currently in this sector, both sort of negative, but perhaps what we have done to advance the conversations at the diplomatic and technical policy level. Thank you.
Thank you, and also hopefully you can hear me. Congratulations on the launch. I think will be a really valuable tool going forward. So I'm really glad that there is an entity that's able to pull the data from the different places together in a sort of stress tested and coherent manner. I think will be very helpful. In terms of the trends, I would agree with a lot of what Flavio said just now. I think we've been seeing very similar trends going on. The past year has I'm going to probably say even increased the attacks that rely on phishing campaigns, that rely on VPNs, because a lot of the work from home efforts, across the board, as well as password sprays, which some of these things are, which are basically an attempt to guess passwords at a large scale attempt, sort of try and target as many individuals as possible. And because we still use fairly simple passwords, a lot of us, and because we do not use MFA, so multi-factor authentication, I think these are still fairly successful attempts. So I think the thing that's important to remember is when we're talking about the technical security challenges, there's the two levels, the sort of the vulnerabilities as was discussed, and then there's also the individual and sort of what what are the action there that kind of we need to take as a community to raise awareness of what are responsible practices that can increase our security. And then obviously, and this has been in the news all the time recently, is we've seen many more attacks that rely on ransomware, which is particularly problematic for hospitals and organizations such as these, as being held to ransom oftentimes means operations being postponed, patients not being seen. So there's a real impact on the day-to-day operations, which is why they get attacked, because there's the attackers know that trying to get the system up and running as quickly as possible is what they want to do, and whether that means paying or whether that means figuring how to respond in some other way, I think is still a little bit by the by. In terms of Microsoft's perspective in this space, we've, like you said, we've engaged a fair amount over the past 2 years on this issue on both a domestic, technical, and sort of international communities. For one example of the sort of technical things that we have done is we've published with sort of extended is probably the right word, account guard, which is a feature in some of our tools that was previously just available to political organizations, that added security features to healthcare organizations to help improve their preparedness during this time. We've also joined you and CyberPeace Institute and ICRC in calling on governments to refrain from attacks on healthcare, like a year and a half ago or so, and supported the calls by the Czech government and others in the UN that there should be a clear prohibition on state-based attacks on healthcare organizations as part of critical infrastructure, but particularly as part of because the pandemic was going on. And that was one of the things, the other technical things that we've seen. We've seen, whether it's the attack on the WHO, whether it's on attacks on vaccine research or pharma companies, it's clear that suddenly these type of data became very valuable across the board, not just to common criminals. And it was great to see increasingly, the UN adopt some language. We feel it could have gone further, but some language that specifically calls out healthcare as an area that needs to be protected. We see increasingly, and I'm sure Richard will talk about it, but the leadership of certain countries that recognize that this is an area that needs special attention domestically, but also internationally, to identify ways to protect it, to bring together the multi-stakeholder communities, to bring the government, the technical, the healthcare, and sort of the big tech perspectives, and try and find effective solutions to improve security. It's not going to be easy for sure. Flavia said that as well. Whether it's looking at the technology going forward, it's going to be hard. But I think the thing that we need to also remember is there's a lot of legacy systems in our healthcare organizations, and making sure that they are secure. It's going to be a substantial investment, both in terms of time, effort, and obviously a financial.
Thank you for that, Kaya. And I think that's a topic that was discussed many times, that the digitization of the sector and the way we secure it haven't really sort of kept up the pace. And that obviously, opened this already vulnerable sector that, that is storing the information, that has a critical operational importance, to further vulnerabilities. And it became a target not only for the criminal groups for ransom, but as we've seen with pharmaceutical companies, a real target also for nation states, because it is now a sector of strategic importance. I think in a round of questions, we will talk about, where we think the data and an information about what's going on and understanding the impact and operational disruption can help. But you kind of mentioned, and it's a great segue to Richard, that there has been key initiatives at the international level. I think we can collectively agree as this group that they have not gone as far as we wanted, but there was clearly an evolution. And we know that these norms for keeping cyberspace secure are continuously discussed at the UN and other international fora. Just earlier this year, as you mentioned, the OEWG report recognized the need to protect the healthcare sector from cyber attacks. But however, we know that the negative trends of attacks continue. And we know that that a lot of times we say, well, it's time to walk the talk and operationalize and enforce these norms. So Richard, from you, I would like to sort of hear your perspective of what you've observed at the diplomatic level in terms of initiatives, and how Czech Republic is one of the countries that is pursuing and pushing for the protection of this sector. Thank you.
Thank you, Clara, very much. And I would like to thank the CPI, the CyberPeace Institute, for the invitation. Congratulate CPI for the successful launch of Cyber Incident Tracer. I watched yesterday's panel discussion on YouTube, which was excellent and quite compelling. I'm pleased to be among such a distinguished and diverse group as civil society, private sector, WHO, ICRC. This is exactly the kind of open, multi-stakeholder exchanges we need to having, including at the UN level. We really appreciate what the CPI is doing, putting a human face and real people at the forefront of the discussion on cybersecurity. The Health Cyber Incident Tracer is a great asset in this regard. The numbers speak for themselves, and Stefan mentioned them already. If anything, the situation is getting worse. We need a global action to protect the healthcare sector and other critical infrastructures from malicious cyber attacks. And as Kaya already and Clara as well already mentioned, the Czech Republic has been paying attention to this topic for a long time in various fora. The UN is one of them. The question is how to get there. What I would like to provide you with is some diplomatic perspective. I will have 3 key points, probably not surprising, but undoubtedly very important. First one, we need to move from walk to action. That's a phrase you already mentioned as well. The second, we need to raise public awareness and generate political will at the highest level. And third, we need to bring all stakeholders together to protect critical infrastructure. So as for the first point, my first concern is the need to move from talking about norms to supporting states in implementing them. From the current discussion on the UN level, it is evident that the international community is united. Cyber attacks on hospitals are a real and growing problem. Such attacks should be absolutely off limits under any circumstances. In fact, and as you already mentioned as well, the latest OEWG and GGE reports make this absolutely clear. The healthcare sector is a vital piece of our critical infrastructure, and we should do everything in our power to protect it. We are pleased that we managed to get this principle of untouchability of the healthcare sector into those groups, open-ended working group and group of government experts outcomes. This was a proposal by a group of countries: Australia, Czech Republic, Japan, Estonia, United States, and Kazakhstan. And here I would like to thank ICRC, who was also absolutely instrumental in bringing attention to this issue. However, having a normative framework in international law that protects critical infrastructure is not enough. This is not a statement of belief. Looking at the increasing number of cyber attacks on healthcare, including as evidenced by latest numbers from CPI, we see this as a fact. We need to walk the talk and help states to implement this normative framework. There are several things we can do right now at diplomatic level to support it. We can agree that normative framework is a start but not the end of itself. We can agree that supporting states to implement the framework is a priority number 1 at the UN level. This means supporting practical capacity buildings to increase healthcare resilience to cyber threats, more technical assistance, exchanging best practices and lessons learned. It means also establishing points of contacts at global level to that whenever there is an incident, we can exchange information on how to mitigate quickly. A diverse group of countries from all regions is proposing to establish a program of action at the United Nations to support this implementation in practical manners. We have been talking about it right now in international fora. And this would bring together all stakeholders: states, civil society, private sector, academia, intergovernmental organization, and move the conversation from norms, which we already have, to taking the practical action. The second point I would like to point out is that diplomats cannot do this alone. We need to generate political will at the highest level and mobilize the general public to our side. I will be frank, our proposal at the UN to protect healthcare wouldn't have been successful without the massive support from other stakeholders and publicity attacks on healthcare received in the media. This issue resonated in many levels, but especially the call to governments and the Oxford process were instrumental in bringing this issue at the forefront of the public attention in the middle of the open-ended working group negotiations. That was excellent timing for us. I would like to give one comparison here. I would like to mention the landmines example. During the negotiations on banning of the landmines, many diplomats didn't believe the process would be successful. There was little political will on the part of some key players, but it was ultimately civil society that generated massive public momentum to ban landmines, but putting a human face on suffering of civilians affected as weapons. So I see here some resemblance. We hope that the moment the agreed could be replicated in some respect to cyber attacks on critical infrastructure, especially in the healthcare sector. Here, the activities of CPI, ICRC, and other civil society actors are absolutely critical. The healthcare cyber incident tracer, as I mentioned already, is a step in the right direction. It allows us to understand the growing extent of the problem and its negative impact on real people. We need public opinion to our side to bring along hesitant states and also ensure appropriate level of public investment and resilience in our infrastructure. My first point concerns the need to bring all stakeholders together to protect healthcare and critical infrastructure, more generally to enforce accountability for violators. Cyberspace is multi-stakeholder domain. It belongs to all of us. We must find solutions together. All actors, civil society, governments, private sectors, academia, and so on. We must hear from all of them. The Czech Republic is a staunch supporter of this multi-stakeholder model of cyberspace governance. We strongly support Canada's proposal to allow all stakeholders to participate in relevant UN discussions, as, by the way, already is the case in some degree to ITU and other technical UN agencies. This is the precedence for this. We need political will here. So this is the approach of the Czech Republic. We very closely cooperate with CPI and Microsoft and ICRC, and I really appreciate that we are working on a common project of protection of health sector. Some series of seminars we would like to have. And as I said, we are really very strong supporter of this multi-stake approach, which we see this is the way how to move forward. So that's my part.
Thank you, Richard, for that. And I mean, it indeed is really, I think it's a huge success and step forward that, you know, the Czech Republic and many others are understanding the need to involve all the stakeholders because of the perspective and the expertise they bring, but because such as the International Committee of the Red Cross, CyberPeace Institute, you know, there is quite a lot of understanding of the impact on the victims. So you talked quite a lot about the normative framework that can apply to protecting the sector. Cordial, I will try the third time the charm. I'm really sorry again for the technical challenges, but we really like to hear, you know, your perspective on the trends, the attacks, what you're seeing in the physical world and cyber, and also, you know, how you think about this normative framework and what are some of the initiatives to continue the protection for the sector. Thank you.
All right. How is this working? It's working?
Yes, it's much better. We'll make it. It will make it work. Thank you for your.
Okay. So thank you very much, Clara. And again, you know, congratulations for putting together this cyber incident tracker, and thank you also for the initiatives you're taking in combining also advocacy with very concrete assistance to you know, those who might be victims of attacks and sort of linking them to the security professionals in order to assist. I think that's really an important and concrete step to protect healthcare, and it is probably also a very good a practical check about what works and what doesn't work. So that's just perhaps to say that. And then you were asking me about the ICRC's work. So the ICRC's work, in a way, perhaps as a background, the ICRC, of course, has always had the protection of the wounded and sick at the heart of its mandate, because, as you know, the first Geneva Convention of 1864 was about the wounded in the battlefield. And the Geneva Conventions have a lot of provisions on the protection of healthcare, on the protection of hospitals, on the protection of medical professionals, and of course the wounded and sick. And so for the past decade or so, the ICRC, together with National Red Cross and Red Crescent societies, has also engaged in a campaign called Healthcare in Danger, which is really about finding concrete and practical measures to protect healthcare in armed conflict situations and other situations of violence, and to find operational responses. So what we do there is we try to influence doctrine and practice, for instance, of the belligerents. We try to influence national legislation. We try to strengthen domestic systems, and we try to build in resilience in the healthcare systems through our assistance work. Now, achieving impact on this is, of course, a long-term endeavor also in the kinetic world. And I think that's the background also against which we have to have this conversation. Now, what's the link to cyber? The ICRC has, of course, also worked for a long time on the question of the digitalization of conflicts and the, if I can say in a non-technical way, the weaponization of cyber operations. And what interests us there is the potential human cost. Just as with any new weapons that we see, or actually old weapons, we always look, first of all, at the human cost of those weapons, and then we look what can be done. And as societies are digitalizing, so of course is armed conflict. And what we saw is interesting because, and it was very interesting to hear Richard just now talking about landmines, because landmines in a way it was difficult politically, but the advocacy was relatively easy because, of course, you can have figures. You had figures about the people being mutilated by landmines. You had figures where you could say, the majority of these victims are children, and it's, these are powerful arguments. It's a little bit different, or it was different when we started thinking about cyber operations in armed conflict, because we kind of had to look at the potential human cost in terms of armed conflict. And so how do you get evidence about the potential human cost? And so we relied, of course, on experts, particularly cybersecurity experts, who were looking at what happens now already, both within and outside of armed conflicts, to tell us about what the potential human threat to human beings would be. And what came out there, and this was already a few years back, was the particular vulnerability of hospitals to cyber attacks, because the health sector had been digitalizing very fast, but the security of the healthcare sector hadn't been keeping up with that digitalization of medical care. And so we released a report quite a few years ago about the potential human cost of cyber operations, and in particular we pointed to this threat to healthcare, and we pointed to the fact that if cyber operations disrupt hospital computers, disrupt medical supply chains, disrupt medical devices, ultimately hospitals can't function and life-saving treatment will not be available. And so what we do about this as ICRC is we work at several levels. So we work at the legal level because the ICRC has the mandate to work for the faithful application and implementation of the Geneva Conventions, or international humanitarian law. And so for a long time we worked on this normative setting, calling to attention that international humanitarian law will apply when cyber operations are carried out in armed conflict, linked to armed conflicts, and also to call to the attention of states that we need more clarity on how they interpret international humanitarian law, and that it is critical how they interpret it for the protection of civilians, and in particular also about, of course, the wounded and sick, or civilian infrastructure. Depending on how you interpret international humanitarian law in relation to cyber operations, you have a protective framework or a less protective framework. And then someone broadening the humanitarian message we had during the COVID-19 pandemic, we started to be more vocal publicly about the specific issue of the healthcare sector. But what's perhaps interesting is just before the pandemic started, in fact, or it had started, but it wasn't declared a global pandemic. In February 2020, we had approached the open-ended working group on the basis of this evidence that we had, to say that it would be good to agree to this unlawfulness and unacceptability of attacking health infrastructure. And at that time, it was taken seriously, but it didn't gain a lot of traction. And it was only during the pandemic, with the evidence then, or the coming out of all these attacks that didn't have to do with armed conflict necessarily, but that were quite starkly, put to the fore, that there was more interest by states on this, and there was eventually this agreement by the open-ended working group that Richard just mentioned about, the prohibition to attack healthcare facilities. So it's quite interesting how you have to combine evidence, even evidence about some potential harm that can come, with evidence that might exist and that is related to an object that you want to protect, but you have to make the links between what people see, what the broader public sees, and what you see on a more expert, evidence base. And I think that's quite important to see. Now, the second aspect, so that's sort of the normative level, and perhaps the second aspect that I want to talk about quickly, and that you mentioned, Clara, is also that while, of course, it is the primary responsibility of states to respect and protect healthcare, what we're also looking for is practical solutions on how to protect health infrastructure, or more broadly, civilian infrastructure, in fact. And a question that we're currently looking at is the following. So over the past 150 years, you've had what is called the distinctive emblems. So the emblems of the Red Cross and Red Crescent that you all know. And they have been used as a sign of protection and identification of certain medical facilities and humanitarian facilities and actors in the physical world. So in times of war, everyone knows that a facility marked by the Red Cross is a medical or humanitarian facility and protected against any form of harm. But of course, no comparable emblem exists in the digital space. So while you might have an emblem on the roof of the hospital, let's say you have a cyber operation that targets data of a hospital, of course, you might not see this. In any case, you might be at the other end of the world. And so the question is, can we have an emblem or signal or something akin to that in the digital world? And so to do that, we've partnered with some research institutions of universities, analyzing these solutions, both from a technical perspective, but also from a political perspective, or rather humanitarian perspective, whether it is actually an opportune thing to do, together with experts in cybersecurity, military experts, medical experts, humanitarian experts, also from around the world, including, of course, one of the CPI experts, for which we are very grateful. Because again, we think it might be a way to propose one small practical solution. We are not sure yet whether this works, but that's perhaps one of the things that I wanted to mention that we're exploring currently. So I'll pass it over to you, and we can then talk more thoughts about these evidence and data questions that you were alluding to, Clara. Thank you.
Thank you very much. And I think in the first round of questions, we will talk a bit about, well, what are some of the practical initiatives we can see in our respective domains, using the data or otherwise to protect the sector. But you talked quite a lot about, the importance of data in protecting the sector, in advocacy work, how we think about connecting the data of the cyber attack to harm or potential harm. And that's a wonderful segue to Jeff French from CISA, who actually has done tremendous work in the past with a group of other experts to really looking at not only the effects of pandemic on the healthcare, but really looking at the effect of ransomware attacks on the sector and ability of the sector to provide the critical care, but also how we connect the attack to some harm. I will share the inside link to the chat, because I think this is something really interesting to look at in this context. And so Jeff, over to you, really how you examine the functional impact and how you were connecting the attacks to the effect on healthcare.
Thank you. Just verify that you can hear me and I'm coming through clearly? Perfect. So thank you very much for inviting me. So among other things, the Cybersecurity and Infrastructure Security Agency has been assessing the effect that the pandemic has had on critical infrastructure, looking primarily at those functional impacts. And I think that our research underscores the importance of the work that you're doing. One of the obvious sectors affected by the pandemic is the healthcare and public health sector. Even before the huge surge in cases that the United States had last winter, we were worried about the effects of the high demand for medical services, the difficulty of ensuring personal protective equipment for everyone, and staff shortages, and how those were magnifying each other. And we saw the functional effects of this when some hospitals had to adopt crisis standards of care. In the fall, hospitals had already moved from what they call conventional standards of care to contingency standards of care. So that's where you have field hospitals or treatment tents and other makeshift accommodations. This is also the phase when hospitals cancel or delay non-urgent care. If things get worse, then after that comes crisis standards of care. This is a major threshold, and it can mean that people are turned away. Medical care may be rationed. Hospital staff may have to decide who gets treatment and who does not. It might mean that patients are seen by staff who would not normally treat those patients. Although the concept was designed with disasters in mind, it was really concerning for us to see these standards authorized or adopted in multiple regions across the country simultaneously. So my team was tracking where these hospitals were adopting crisis standards of care, and made sense that that would have some effect on the other surrounding hospitals and on people. We knew, for example, that the percent of COVID patients was a key indicator for hospital administrators, and that once it reached 10%, the hospital would likely encounter problems offering normal services. We observed how capacity affected this, and that there were lots of people who needed help who couldn't get it. We also knew that people were avoiding hospitals, likely out of fear of contracting COVID-19. One study showed that between March and June 2020, for example, emergency department visits declined by about 23%. So we were looking for ways to measure the consequence of this, and started looking at excess deaths for insights. So as you might know, statistically speaking, the number of people who die from a specific cause at a specific time of year is relatively stable from year to year. So excess deaths, which is formally defined as the difference between the expected and observed number of deaths in a specific time period, are what the health community calls those deaths above what you expect. So what we found was that Americans were dying at a higher rate from things like heart attacks and strokes. Total excess deaths, so both COVID and non-COVID combined, correlated to where and when hospitals were strained, not just at the national level, but also at the state and local level. So there's no good data that indicate how well a hospital is operating or the extent to which it's strained. So we used the proxy of the percent of beds in intensive care units that were occupied. And we saw that when ICU bed utilization hit 75%, you would expect to see excess deaths over the next 6 weeks. So let me try to be clear about this part of it, though. Although collective hospital strain is complex and it's a multi-dimensional problem, what our analysis indicates is that bed utilization is a key indicator for, but not the sole contributing factor to, the stress to the functioning of the healthcare and public health sector, with direct and indirect consequences of excess deaths that emerge in the weeks that follow a surge in COVID-19 hospitalizations. So what these proxy indicators allowed us to do, though, is examine the effect of a ransomware attack that occurred as COVID cases were growing in late 2020. So we'd already been documenting the effects of the attack through public sources, and one of our first observations was how long the effects endured. So immediately after the event, the entire IT network was down. After a week, available offline backups of the system were accessible, restoring access to some things. Over the next 2 weeks, network functionality started to return more rapidly. And this is what people tend to think of when they consider the length of time a cyber attack takes to resolve. But even after more than a month, some network devices remained offline for cleaning or repair. So a majority of the software, of the hardware had been restored, but there were still some outages. 5 to 6 months after the attack, all hardware and access had been restored, but even then, some tools remained out of service. So what this allowed us to do was examine the ICU bed use rates of facilities in this state where the attack occurred. We compared those facilities that were hit to those that were not, and saw that in the 5-month period immediately following the cyber attack, affected hospitals were more likely to experience hospital strain even when we controlled for date, size of the hospital, and type of facility. So again, although ICU utilization is a proxy indicator for stress to hospital operations, it's unfortunately also the state of the art, absent a better, more commonly accepted model for measuring operational impact. ICU utilization would appear to be solely a function of these external pressures, right? Of how many patients show up and how many of them need services. But what the case study allows us to do is to control for those external pressures. The data analysis shows that the hospitals affected by ransomware reached that indicator of high stress faster than their neighbors in the same state, facing the same conditions, indicating an internal factor. So this supports the assessment of the longer-term implications of cyber attacks and the effect the effect that they have on degrading hospital capacity and implicating worsened health outcomes. But it also highlights the needs for more data on the number and types of cyber attacks on the healthcare and public health sector, including data on the severity and duration of the effects of cyber attacks on healthcare facilities. So thank you very much for posting the link to the study. It's sort of a long piece, so I tried my best to summarize it as succinctly as I could.
Thank you very much, and I'll turn to questions. To question really about to several of you. You know, I think several of speakers mentioned that there is data. We're trying to link the attacks to the harm and the degradation of the sector. You know, I think that the question here that comes to my mind, and I know many others are thinking about it, is you know, how are we going to use this evidence and data to help the efforts? What are some of the best practices we've seen, you know, in changing the behavior of stakeholders? I mean, Richard mentioned what we've seen around landmines, but how we can, you know, what you, Jeff, you know, I'll leave it to you first. You know, what are you hoping to achieve with showing this correlation?
As I said, I actually think it really supports the effort that, and others like it, that you're pursuing, where we're calling for the need for better data. So if you want to make another comparison similar to landmines, if you think about how the healthcare community took on medical errors, by being able to start getting some numbers around that, it caused not just hospital administrators, right, but society in general to think in very concrete terms about how you address those and how you reduce those risks. So that's the type of thing that we at DHS and at CISA in particular are trying to emphasize is that we need better objective metrics for the extent to which hospitals or other healthcare facilities are affected by the cyber attacks, but even getting our handle on the raw numbers of the attacks, the type of attack. It's sort of a patchwork of regulation right now in terms of what hospitals have to report and what they voluntarily report. So some of that basically any of those reports can go to 3 different agencies. So underscoring that message of we need better data, we need better public-private partnerships to address, right, to really describe those risks, I think is one of the key parts in then getting that coalition to manage those risks.
Thank you. And you know, Cordula, I'd like to turn back to you very briefly. You know, we've briefly talked about this when we spoke before the event. You know, how we bring on the change, that accountability, the change of behavior in actors' sort of stance or their actions. You know, by showing them the data. Can you share some of, you know, the experience, you know, practical experience you've had in affecting the change through data. I mean, you've already talked a bit about it, but are there any other issues, you know, that you found that where data really help, or how data can really help in the work?
Yeah, I'm sort of thinking about it now also after what Jeffrey was saying, and I think it depends a bit on where the gap is that you're trying to fill, or rather where the hurdle is that you're trying to address. And I can perhaps see three now spontaneously. One is the normative level, you know, when we're talking about, in a way, the opprobrium of attacking healthcare, the unlawfulness of it as well. And to my mind, I'm not even sure you need all that much more data. First of all, it's prohibited anyway under international law, and I think that is something that has been reaffirmed by the international community. So in a way, you don't have really a normative gap that you have to fill. There are details around, you know, is medical data an object that has to be protected, etc. But these are more technical questions for which I think data is not perhaps the critical issue. Then you have the question of respect for the norms, you know, and so you have the question, and this is always the case in armed conflict situations, is the key really is respect, and that I think is something that requires dialogue, and perhaps data that shows the human suffering that comes from, you know, attacks on hospitals, etc., is something that can help when there is denial. But that isn't always the case either. You know, sometimes attack might be deliberate, and then data is not what's going to change. What's going to change the issue? Then it's really persuasion and so on. But still, I think to be able to describe the consequences for human beings, including human beings for which, you know, states or non-state parties are, you know, in a way often under their control, and they have an interest in the well-being of the population, can help. But critically, perhaps the third area is the investment into building stronger systems. And if I understand correctly, but this is really where Flavio and Jeffrey and others have much more understanding than me, there are vulnerabilities in this sector that need to be patched, as it were. And I wonder, and I will almost throw the question back to the experts, where it is really critical to have data on the extent of the damage, on the extent of the cost, and on the extent of what it can mean for patients, is critical in order to have more attention to building more resilient systems.
Thank you for that perspective, Cordula. And I think that's the question we can try to explore for with others. But I want to give a floor to Stefan. You know, given the where the CyberPeace Institute is trying to go with this platform and where it's work, you know, how do you see, or who do you see, you know, can use this information, and what again we're trying to achieve with showing the connection between operational disruption and harm?
No, thank you, Clara. And to react on what was said before, the ambition of the Cyber Incident Tracer is to be a living object. So we could gather what we could gather. So already the first finding is that there's a huge bias exists today in data when it comes to what we know are attacks on healthcare. So the first call throughout this platform is to engage with partners to have better quality of data, because to the point of Cordula just now and other colleagues before, we believe in the added value of mapping the societal impact of these attacks. There's an attack, what is happening next? And to put this attack into a longer memory. There was an attack 6 months ago, what happened since then? And this, the audience would be, researcher when it comes to societal impact of attack, what does it cost to society, but also looking into the effectiveness of processes for accountability and within accountability attribution. How does it work? Is this useful? Is this helpful for victims at the end of the day, looking this over time? So the platform is about this, providing a tool so that we can do this at scale with more partnership, more data to have a global view. And not forgetting about the victims. Really, the one that at the end of the day are attacked, sometimes they just did not even know that they're attacked. I mean, they will need to have like a darknet monitoring the whole day to see if their data are sold somewhere in a shady forum. So also, what is it that the community owns to these people, to these victims, and how can they be empowered with knowledge in order to hold their states accountable? Because at the end of the day, their states have a responsibility to protect them. So that will be some pointers from my point of view, Clara.
Thank you, Stefan. And I will turn to Richard. You talked about these developments. Can you share, your perspective, how you think the data and understanding actually the physical harm, you mentioned one example, but how you think that understanding or better understanding and measuring the societal harm and impact of these attacks on individuals can help the diplomatic efforts?
Thank you, Clara. I think it's absolutely essential. And here I can follow what already Jeff said. And what I mentioned in the beginning is that what is our intention is to generate a political will, really to start to do something together. So from this point of view, I would like to say that that Czech Republic started to be involved in this process is not by chance. It was just logical consequences of the development in the Czech Republic. With a couple of local hospitals affected by cyber attacks. So for us, it's really essential that those people are aware that it's not local case, it's something global, and we need to find some global approach how to solve it. So your project concerning the cyber incident tracer is exactly how to increase this awareness of people about this context, which is absolutely essential for us. Here, I think that also I would like to point out that what we would like to show is that what we are doing is not theory. It's not just some theoretical exercises. We see the concrete impact on people. If I remember well, it happened last year in the Düsseldorf hospital. I remember well when there was even human loss as some consequence of cyber attacks. So this is already humanitarian law. It's something we have to be really involved, and the ICRC is exactly the institution who has many expertise and could provide expertise how to show what we can do. So from this point of view, we really see important to mediate things and to have this general discussion. So from this is our approach.
Thank you for that, Richard. And I think the technical initiatives and diplomatic initiatives and the normatives one, they really all go hand in hand. I mean, Flavio, from your perspective, I think if we see the data and evidence, and we understand, what we have to do on sort of the cyber hygiene and defending the system sort of side, what is still missing? Sort of what is still the missing piece, in the equation? We've mentioned all these initiatives, again, understanding and showing some of the harm and impact. We know what good cyber hygiene is. What's the missing part?
Yeah, I think understanding the impact is quite important. I think we advanced a lot. However, hackers, cyber criminals, they will not respect the law. So first of all, having a lot of norms and goodwill from international organizations or governments will not stop at all cyber attacks. So that is one thing that I can confirm to you. So I think the missing, I'm talking about the missing element. So what's missing? I think the missing element is to really understand the risks that organizations are taking, hospitals, the healthcare industry, and this is very generic. So understanding well the risks, and just to trying to answer a question that happened before, from the technical point of view, software is vulnerable from the beginning because software is built by people. You can try to protect, but vulnerabilities will always exist. So the cybersecurity journey is an ongoing journey. So what's missing is this is an ongoing concern, and having that understanding that is an ongoing concern helps to close the gaps, the big gaps that we will encounter, because it's not something that you can start and stop. It is something that has an ongoing concern because software will always change over time, and you need to have multiple layers of protection, multiple layers of detection, and multiple layers of response. So the missing components are the practical ways. I'm going to use the analogy of the landmines. Try to imagine that in the past, landmines was a big concern, and we progressed a lot. But try to imagine that every landmine is an atom, because everything in business and in the digital will have that vulnerability, will have that risk. So essentially, the problem is way bigger. It's very similar, but way bigger. And we need to really understand how can we connect all those processes. Again, detection, protection, and recovery. The big part that I wanted to finish my explanation is we cannot have a misconception that there is a technical solution for the problem. It is a combined solution, and only a technical solution will not solve, because any technical solution will have vulnerabilities.
Thank you for that, Flavio. I think the community is slowly and surely realizing that it's very hard to defend our way out of this problem, and then it's unrealistic to think that every small hospital and every small healthcare facility will be able to defend itself out of the problem. So that's the role for the concerted diplomacy and other initiative. And I'd like to turn to Kaya, because from where you sit in the industry, but I would say perhaps even more importantly, you engage both in a set of diplomatic processes, but also more the technical policy initiatives like Tech Accord. So you see the range, you see the range of the issues that are happening. What is sort of the missing part? We have the technology, we have the diplomatic processes, and we have the technical policy where we are talking about standards and best practices. How do you think we can connect them, and what are the missing parts in this conversation?
And I think I will probably agree and disagree with some of the things that have been said earlier. I think, in terms of, definitely completely agree. I think it's important to understand that cybersecurity is not a point in time, as Flavio just said. It's a constant risk management effort. I mean, we do it in other areas of our lives. It's just that sort of the ICT is fairly new, and I think that's kind of not the mindset we've adopted yet. And I think that's where hopefully data such as this that talks about the impact, like real impact on real people, actually helps, because it's clear that we for years have heard the billions, the millions of dollars, euros, whatever it is, Swiss francs lost to cybercrime, and that's clearly not a message that's landed with anybody. And I think it's so demonstrating what it means, and not just sort of obviously and I think only yesterday Richard talked about the death, I think, in Germany last year. I think there was a similar story that was reported yesterday, and it's so not just those, but the long-term impacts on healthcare as a whole. As Jeff was talking about, I think it's important for people to hear, understand, and make the link between as a European, like investments in the healthcare sector that come from our governments, what is the impact if there's no action against attacks on them? And is there a responsibility that goes with it? I think that I would disagree with the fact that sort of norms and international initiatives don't do anything. I think they're really, really important. I completely agree. Cyber attacks will not go away. That's just, I think, is true in all aspects of, where we have rules. Rules will be broken. But hopefully it means that the vast majority of individuals, of countries, of organizations follow them. And there is a clear message in terms of, even companies, like you said, coming together, whether it's Charter of Trust, whether it's Cybersecurity Tech Accord, stating we are investing in this area, this is what we're doing, this, supply chain security is an important priority, and this is why, and these are best practices. It's an important signal to a broader community. And similarly on the government side, aligning around particular norms, interpretations of international laws, conventions, like strengthens the case of, the rule is important, we're following it. That means that the person, state, whatever, that breaks it should face consequences. And I think that's the bit where we're missing. We're missing the accountability piece for a lot of these things. I think, whether it's for states, whether it's for criminals, too many times they still get away with it. And I think that's we need to make the connections between also sort of, yes, investments in security and technology, yes, having rules and they are strong and strengthened, and then also acting on those rules when they're broken.
Thank you, Kaya. And before turning on to Jeff with a question, I just make a sort of shameless plug for the CyberPeace Institute. I mean, this is part of the work we're trying to think about and conceptualize is how do you actually bring norms to life? How do you explain when a cyber attacks happen, what was actually broken? Was there a norm or a rule that applied, in peacetime? Was it a commitment to protect critical infrastructure? Was it a different commitment a state made? And we think it's so important, as someone said it, bring norms to life and explain them what they actually means, because sometimes I feel that the conversation about the norms and what's happening on a day-to-day basis, even if we have you have sovereignty, you have non-intervention, you have due diligence, what do these rules mean? In this context, I think it's from my perspective, it definitely empowers the individual to understand what a state owed to them, in their responsibility to protect their individuals, but also, really be more empowered to call for accountability, whether towards their own government or the accountability of their government towards the other actors. And I think this is really, really important to address. Before we go to Jeff on some of the data challenges, Flavio, I want to give you a floor for a second to add to this.
That's great. I think norms are very important, no doubt. Unfortunately, what we are seeing is norms are being broken all the time. And I agree with what you said before, that it's quite important to have the accountability and to be able to have consequences for sure. The difficulty here is in the digital environment is very difficult to pinpoint the real originator. On the physical environment, I think it is way easier. It's not easy, but way easier than a digital environment, because in the digital environment you can simulate, you can really create a situation that is way harder. I just wanted to mention again, international laws, I applaud all countries that supported all the measures to protect the healthcare sector. But again, the reality is we are still seeing lots of attacks on the healthcare, even though countries are working very hard to really create some normatives, but accountability is very difficult to implement, and I think we should think more about how to do it.
And I mean, if I just may stay on this for 1 second, I think you know, Flavio raises an important point, and it's something we've heard in this community for many years. You know, it's hard to pinpoint, it's hard to, you know, attribute, but I think it's been established broadly that technical attribution is feasible. The political attribution and the political will, it's a separate issue. So, you know, I think that we've also talked quite a lot about, you know, what is the role of the normative framework to try to recall those obligations and have that political will. But Cordula, may I just for a second, you know, to turn to you to share your experience about how you worked to achieve that sort of political will for change. You know, if you can share some of the experiences, because again, the data is one thing. Sometimes you know where the attacks come from, but political will and that the pressure, you know, with or in the absence of normative framework may be something else. So if you could just share with us your perspectives on that.
Thank you. Yes. I mean, yeah, perhaps to start off with what Kaya says, I would also say, and I think Flavio agrees, that, you know, the norm is the bottom line, it's the starting point. And it needs to be correct, it needs to be correctly interpreted, it needs to be interpreted in good faith and with no loopholes. So that's perhaps one of the steps that can be taken, because we do see sometimes states seek to have a maximum leeway for themselves to act, and therefore interpret the law in a way that doesn't bind them. And that is, I think, problematic from the perspective of the victims of armed conflicts and operations, but it can also come back to haunt you if you have such a broad, you know, and lax interpretation. So that's one thing to do. And then, you know, the question of deniability of cyber operations linked to this deniability being an obstacle to accountability and consequences. And Kaya was saying, I think rightly well, if you have norms, there should be consequences to not respecting the norms. That's correct. The fact is that, you know, if you take a step back from cyberspace and you just go to the general issue of international law, you know, lack of accountability, widespread impunity for violations is, you know, a reality, or, you know, in many respects. And that's sort of my everyday challenge, right? Is how to make the law better respected. And if I had a silver bullet, I can guarantee you haven't used it. There is no silver bullet. So there is not, you know, when you're asking for the missing piece, there is no one missing piece. And I think everyone on this panel has talked about the fact that the work has to be done at several levels. It has to be done at the normative level. And then, as I said before, and one of the things that we also try to do very much is really also at the domestic level then to change laws, domestic legislation, military manuals to train the armed actors in order to not only teach and train about the law, but also to embed that into a moral acceptance of the law, and to really make the link. And this is very often very important for the military. It's not just the law, but it's the ethical piece about it. And I think this is something that can be very strong when you talk about medical infrastructure, about the wounded and sick. I mean, the ethical imperative to protect the wounded and sick, regardless of which side they are on. And I think this is also something that's very important, is that sometimes, you know, those of the other side are not perceived as being so worthy of protection. And so to really do this work of persuasion, there's nothing, we cannot get around that. This also needs to be done. And then there's the question about accountability. And I think there, this is not the way the ICRC works, in a very confidential bilateral way. So when I now take a step away from the ICRC, I think this is also still where public knowledge, calling out also can make a difference. And that's something that other actors, I think, can also do, and can do usefully and sometimes also effectively.
Thank you. Yeah, I think we've heard it several times even today, but I really do see this trend in the cyber domain that, talking really about the human impact, about what the operational disruption meant for a human. I think operational disruption in terms of technical and how many days and what we had to restore. I mean, that's one part of the story, but I think we're seeing this increasing attention to it. But what we've seen is that the information is piecemeal. It's not well reported. There's no legal requirements to report. When you couldn't operate as a hospital, we know it's a different question. Around PII, but have we paid ransomware? What was the disruption? What it actually meant for our operations, and I think that's sort of an interim, I think, important step. But I think there's a bit of a change, and I will close in. We'll be closing in about 10 minutes, and my closing question will be about where do you see the light? What sort of leaves you with hope that we can change that? So I'll give you a couple of minutes to think about the positive, to end on a positive note. But I want to turn to Jeff for a minute, particularly on this data challenge and the difficulty having data, understanding data, analyzing data, because I think the advocacy and informed policy making can happen only if we have that solid base. So would like to hear, you've done an important piece of work on data. So please share with us what were some of the challenges.
Yes, and I think you've actually touched on a couple of them right away. So one of the first is the availability of the data. So in the United States, at least, if a healthcare facility is hit with a cyber attack, if it results in a data breach, then they do need to report that to the Department of Health and Human Services. If they want federal law enforcement assistance, they would report it to FBI, but they don't have to. They might also report that to state and local law enforcement, depending. But of course, they don't necessarily have to report it to any law enforcement entity, and they can report it to CISA, especially if they're looking for technical assistance in either responding to the ransomware attack or restoration or any other of those technical aspects. But what that left us with in late summer and fall of last year, where we were really looking to ensure that we didn't have disruptions in terms of vaccine development or vaccine delivery, therapeutics, and then administration of the vaccines and hospital operations. We knew that we didn't have a complete picture in terms of even where those attacks were happening, even though we could see evidence of, especially around the cold chain with regard to logistics. We could see attacks at different types of facilities in that chain. We didn't feel that we had thorough data. And then secondly, getting into what you were talking about with the operational impacts. When a healthcare facility, and again, this is more uniform than just the healthcare, but organizations that are hit with cyber attacks, typically their first response is to say there were no operational impacts. So you typically have to ask more specific questions. Did you have to divert ambulances? Did you have to curtail the services that you offered? To what extent were there delays in accessing records or testing or things like that? So it was frankly the fact that we were able to observe this incident for so long that allowed us to get different press reports or things that the victim organization said, or things that patients were saying, and allowed us to kind of put together that piece of what the operational effects of the cyber attack really were. And then, but as I mentioned previously, there's no good objective data on this, so we did have to rely on proxy data. And even then, when a lot of times when people see our analysis for the first time, they worry that we're blaming the victim or we're trying to kick a victim when they're down, and that's really not our intent. Our intent really is to be an advocate for these organizations that are victims of crime, and there are real-world consequences, and as you pointed out, right, that affect just the regular citizens.
Thank you for that. I mean, it's you know, I think we could have another conversation about, you know, how we think what should happen to have that data, but unfortunately we do not have time for that today. So I will open for sort of a closing round, starting with Stefan, you know, for any sort of closing thoughts, but really where do you see the positive, you know, in what we can achieve, and whether based on what happened in the past year in terms of positive developments, or what are the positive developments you're hoping for. So I'll start with Stefan, and then I'll go around the table.
Thank you, Clara. I'll be quick. I mean, when you see over the past 16 months, the call to government that we coordinated with the ICRC and Microsoft, how energies were put together with the very different partners in order to have healthcare spelled out as a no attack zone, both in UN Open Ended Working Group and the GGE, and looking also how criminals are reacting on the other end. When you see the way they discuss in multiple criminal groups, the fact that they spell out that healthcare should be out of border, I mean, for different reasons, but it's just saying that the fact that multi-stakeholder, and I go back to what was mentioned before, that there's different layers of response from the operational layer to the normative one, going into standard and technology, is moving the ecosystem. And that's how we are going to get this improved. And at least the trends in terms of effort against the threats is a positive one. Is this matching the threat? History will tell.
Thank you. I'll move to Flavio and then Kaya.
What I can summarize here is, I think, collaboration and having the data to really understand the risk and understand the impact of cyber attacks, so we can help governments, international organizations to really work together and create a journey, an ongoing process for cybersecurity, because it's often seen as part of the ICT, part of the information technology, and it is not. I think it is important to have that aspect, because there are other elements such as social engineering and a lot of people, process, and technology involved. And the work that the CyberPeace Institute is doing is fantastic, because it's one way to really capture the data and help, and way to help also no-profit organizations to really sustain or address cyber attacks. And in any way, I think it is a team sport. We need to improve collaboration. And this is basically my closing comments, because I think only by doing that, we'll be able to progress in this journey.
Thank you, Flavio. Kaya, over to you on closing thoughts and sort of hope for the future.
Yeah, and I'll be super quick because I know we have like less than a minute left. But I think I would probably say like initiatives like this, I think the multi-stakeholder conversations that are specifically designed to share expertise from different viewpoints, and then sort of also, initiatives like the tracer itself, where the idea is to kind of bring information together from different places, reputable information. So it's not, kind of just like doesn't just live in different silos. And so I think we can do a lot with data that is out there already. I think it's important to try and start pulling it together and actually gain insight on what it all means.
Thank you. Kaya, Cordula, would you like to share your closing thoughts and perhaps your hope for the future? And then Richard, after Cordula, on where do you see sort of hope in the diplomatic processes? Thank you.
Thank you. Thank you for the opportunity. I can be very positive. I have seen a big progress. We've been progressing concerning mediation, thanks to you as well. we are progressing concerning the attribution, the technical attribution, but also in political attribution. Here, the intention of the Czech Republic is to be very precise. So if we have some political statement, we would like to precisely specify which norms were broken and what exactly happened in context of international law. And as for health sector, we have really the scope of possibilities. We have concrete norms, 13G, 13H, doesn't matter. We can really specify. What we see as a next step is to be more involved in exchange of those technical expertise, because in Czech Republic we are very careful. If we don't have to provide this political statement, we must be sure that we know exactly what was happening. So from this point of view, if we are not sure, you can see our statements are very general. We are saying that we are concerned of the information provided by our allies and so on. But what we need is to be sure that our attribution, political attribution, is really correct. And here I really see the big potential for cooperation with private sector, with NGOs, with others. Exactly, the multi-stakeholders could improve this knowledge. We can use then in political statements. So that's my positive view and light I see in our journey to be stronger in cybersecurity. Thank you.
Thank you for that, Richard Cordula, and then we'll wrap with Jeff.
Yes, thanks. Two things. One is really what we discussed today, and is really to have more data and evidence about the human impact of cyber operations. That's something that at the ICSC we've really been trying to push, and it's really good to see that, you know, we're talking about, you know, data with a human face, as it were. And just what Jeff was saying is so interesting, I found, you know, when you go to organizations, perhaps the answer might be, oh yeah, you know, but it only costs so much, or, you know, it was only disrupted for so long. But the question is, how did it affect the patients? How did it affect human beings? So there's still a long way to go in this, but I think the fact that we're aware that this is what really needs to be looked at, I think is great. And then secondly, just like Kaya, just like Richard, I mean, for us, you know, 2021 was, of course, it was a year of progress at the international level, and we're really happy about this. It's a tiny progress, it's a tiny step, but in a world that is so divided politically at the moment, where international agreement is so difficult, and in particular, you know, cyber issues really divide the world. It was great to see that, you know, agreement could be found on, you know, application of humanitarian law on the healthcare sector in particular. So that is really, I think, a really hopeful step, and I think that's where we really need to also, on the other hand, go much further. So really to find agreement across political divides, and perhaps also implicating the global south more than has been done at the moment, because ultimately there will also be populations that will be affected by those operations, and I think to hear the voices of the global south at the international level is also good, and progress, and I would really like to see more of that as well. Thank you.
Thank you, and I know we ran 4 minutes over time. So you know, Jeff, really just from you, you've done a very important first step. You know, how do you see this evolving? You know, the work you are doing.
What we're hoping is that one of the things that the pandemic has done has shown a spotlight on the extent to which healthcare systems can be disrupted, and then in parallel with that, the role that cyber attacks and ransomware in particular can have an analogous effect. So what we're hoping is that there's a greater awareness of these risks, and that you get commensurate investment in managing those risks, and not just at the facility level with the healthcare organizations, but also at the governmental level. The government agencies have to understand their roles and their responsibilities in documenting and managing these risks. And then one of the things, again, that the pandemic has really shown a light on is the international aspect of this, and the commonality of those vulnerabilities around the globe. So I'm hoping that this leads to commensurate investments for everything from the local level through up to the international level.
Thank you for that. And I will let Stefan wrap in 30 seconds on a call to action that we are publishing or sort of launching, with this cyber incident tracer, mostly on collaboration. Stefan.
No, thank you, Clara. Very quickly. So just mention the fact it was a journey. It is a journey, and we are not at the end of it. So the cyber incident tracer is really a call for partnership and contributions. We mentioned the need to have better data. This is a call for a collection of data. So partners, volunteers, the one that really want to help us to better map the reality of this threat and the societal impact are more than welcome. So please contact us, including helping us with the technical development of the platform. There's better visualization, analysis to help decision making, and as we're mentioning before, empowerment of people to hold mostly states also accountable. And the other call is to join us into designing this methodology to measure the societal impact of this attack, but also to track attribution, efforts, and how they are helpful in the long term for accountability. So we are open to a contribution and help and partnership, and feel free to contact us.
Thank you, Stefan, and thank you everyone for being so generous with your time today and with your expertise. We look forward to engaging with you in the future on this topic. And for those who participated as audience, please don't hesitate to reach out to us for this collaboration and to engage on this topic. So thank you again, everyone. Apologies for running over, but this is an absolutely amazing group. So I wanted to get out of them as much as I could. Good afternoon and good day to everyone, and thank you again.
Thank you.